The American Medical Association recently decided to classify obesity as a disease, a condition that affects 1 in 3 Americans. I took a look at what this new classification means for people struggling with their weight and what our community is doing to help fight the growing problem. Joe Delapena is just one of the thousands who are obese in the United States today. It was the moment he couldn't buckle his seatbelt on an airplane that served as a wake-up call.
I was like, wow, I don't fit in normal sized things anymore. I was at Harry Potter World in Orlando, and I couldn't ride one of the roller coasters because it wouldn't like come down over my belly. So I'm like, okay, this is reason for me to drop a few pounds.
Obesity has been on the rise for decades, but when the American Medical Association comes together and makes a recommendation, the medical community listens. The AMA's new way of looking at obesity may have an important impact on treating the condition.
A disease, by the definition of the medical world, is a condition that needs treatment, and if it does not be treated, it perhaps can progress into something worse or something more.
Is it a lifestyle disease? Would we say to somebody, you don't have a disease because you got lung cancer from smoking cigarettes? Would we say you don't have a disease? We would say, of course you do. So I think there are people who have what I would call a disease. They have a pathological impact on their organs, and they're struggling with it.
Krishna Shah is the CEO of Downsize Fitness, who once weighed 400 pounds and understands the seriousness of obesity.
I think that it's finally bringing a level of medical awareness and a stamp to a cause that so desperately needs this. And it's not just obesity, it's all the associated comorbidities, whether that's diabetes, heart disease, stroke, different other types of health ailments that can affect us due to obesity.
While the AMA's move is seen as a positive step forward, some are worried the attention the new label brings won't always be positive.
Anytime we label somebody as something, I think it becomes a blow to their identity, a blow to their esteem. When we call people fat, first of all, anybody who has tried to control their weight know how hard it is. People are genetically often overweight. They come from family histories where their parents and their grandparents had weight problems. So they didn't come here because they're binging on a large amount of food. They have a genetic proclivity to it. To call them fat is just devastating.
My own fears or my thought process is our insurance company is going to be looking at that as a parameter to increase people premiums.
Healthcare workers agree patients who are obese need to be treated, but determining obesity's effects on the body isn't as simple as just calculating your body mass index.
You could be the Terminator and have a BMI over 30 because you have so much muscle mass. It doesn't tell us what kind of shape you're in. So if you are very overweight and you're having cardiac problems and you may be diabetic, then your health concerns make losing weight or getting a control over the weight really important, and you can't really delay.
And the reasons people struggle with their weight are just as complicated.
For a long time, we thought disease is just as a habit. This is a lot more complex. It has to do with, hunger, metabolisms, and whatnot. So it has a lot to do with multiple aspects of things.
One of the unique tools Naperville has to fight obesity is a new fitness facility called Downsize Fitness. With locations in New York City, Dallas, Chicago, and now Naperville, Downsize is focused on helping clients with more than 50 pounds to lose who may feel uncomfortable in a traditional gym.
I was 400 pounds. I lost over 75 pounds before I went to a gym because it was just so intimidating. And even after losing 75 pounds, I was the heaviest member there at 325, and I couldn't do anything. Downsize provides the support and community that is necessary to fight obesity.
Jeanie Przybylski is a client of Downsize and knows that labeling people isn't enough. You have to change their mentalities.
I've been told I'm obese my entire life. I mean, it is a disease. It's sad. I mean, here in America, I think people eat way too many big portion sizes. I think there's not enough activity. I think people work longer hours, and we're more career focused here than maybe other societies. But it's an epidemic, and it needs to be correct it. And you need to start with children, and you know, I want to be a good example for my children. That's another reason why I want to be healthy.
Before, I just ate whatever I wanted to. It's easier to go grab a burger at McDonald's than it is to, make your own food at home. I just had no direction. One of the great things about Downsize is that you get to work with a nutritionist, a dietitian, and she helped steer me in the right direction. And she's amazing. She's realistic. She understands like the time restraints of life and helps you make better choices with your food.
Health and fitness columnist Nicki Anderson knows it's not all or nothing. It's a long process that starts with baby steps.
Start with one thing. For example, say you never eat vegetables in your day. I'm going to make the commitment that at lunchtime every day I'm going to bring lunch from home, or if I'm going to go out to eat, I'm going to include vegetables in some way. And no, that doesn't include tomato on a hamburger. I'm talking about trying to have a fresh salad and having lots of vegetables in there. So, one thing. And then once you kind of get into that habit, then another, then another.
What you're fueling your body with is important as those struggling with their weight start on their fitness journeys.
People just need to eat more whole foods and less processed foods. Culturally, we have just moved closer and closer towards everything that's in a box that comes out of a box, and including fast food. So it's just time to slowly make the shift.
Obesity can lead to serious health conditions like diabetes and heart disease. For those who need more medical intervention, Edward Hospital will be opening up an obesity clinic at the end of the summer, where they will use a comprehensive medical approach. Dr. Jabbar will be the head of it.
Where we're looking to have a physician, myself, doing mainly medication management, and we'll have dietitian that's going to be talking to them about diet modification, an exercise physiologist talking to them about exercise, and we're also thinking of incorporating a psychologist.
There are certainly instances for some people, food is an addiction. For most people, it's a compulsion. It goes along with urges and drives to eat, and they're very often satisfying psychological or emotional or other kinds of needs that they have.
For Jeanie, embarking on a healthier lifestyle is something she wants to do for herself.
I just want to be healthy. I just want to be able to feel good about myself. And at this point, it's not about size. It's not about getting to a size 10. I just want to get to a point where I'm working out, I'm active, and I'm healthy. I'm not trying to be thin. I'm just trying to be at a healthy weight that my body says, this is okay.
Reporting for Naperville News Extra, I'm Jordan Abudayyeh.